How are we?
Yep, full
Okay.
presentation. Yep, perfect.
Beautiful. Eastern Melbourne PHN acknowledges the Wurundjeri people and other people of the Kulin Nations on whose unceded lands our work in the community takes place. MFN respectfully acknowledges their ancestors and elders past, present and emerging. We recognise and value the knowledge and wisdom of people with lived experience, their supporters and the practitioners who work with them. We celebrate their strengths and resilience in facing the challenges associated with their recovery and knowledge the importance of contribution that they make to the development and delivery of health and community services. So just a reminder, everyone, you are on mute, so please type your questions in the Q&A box and John will be happy to address them at the end of the presentation. We are recording today's session and all attendees will get emailed a copy of the slides, any resources and the recording. We also ask at the end of the presentation if you could complete the short evaluation survey. So our speaker today is John Williams. John has been an Executive Director of HealthPoint since it began in 2004. He has more than 25 years experience working in the health sector in Australia and New Zealand. And John, I'll leave it over to you now to continue on with your presentation.
Great, thank you very much, Leonie. What I thought I'd do is I've got a few slides which I'll cover off with you. And as we work through the slides, please, if you've got any questions, put them in the chat and I'll pause at the end of the slides before I go into the ERPT itself. Because what I'm going to do is just go through the overall content in the ERPT. And we're really excited because we included 2 nights ago some brand new content into the tool. And that content came from the RACGP. And as you all know, because the content and we work closely with the RACGP, it automatically complies with the 5th edition of the GP standards towards your accreditation. So what I'm going to do is I'm just going to share my screen. So just bear with me a sec. And Leonie, if you could tell me when you can see that.
Yes, John, we can see that. Just would like to pop that in presenter view.
Okay. How's that?
Yeah, we can. Why don't we just make a start with this, I think.
Okay, so is it in present?
No,
presentation?
it's not.
It's not.
No,
okay.
it's not.
Interesting. All right.
It's just today.
It's just today, the gremlins. All right. Okay. So we're going to be talking about the ERPT today. So the Emergency Response Planning Tool. Now, this was developed in 2013 in conjunction with the RACGP. So what actually is the ERPT and what is it for? So the original premise was that the ERPT was developed to assist general practice to prepare, respond and recover from any unplanned event, in particular an emergency event or pandemic. Now, when I'm in an emergency event, in general practice, the same as in any organization, you can have many unplanned events. So it doesn't have to be a wide scale emergency. It can be something quite local to the practice that actually disrupts the ability to provide service to the community. So it could be a power outage, could be a flood, could be a burst water pipe, it could be a number of things. So the ERPT is what we call an all hazards approach to emergency planning. And that means it takes into account a whole lot of different risks, if you like. The second thing included in the ERPT, and whilst it's in the content, if you look at the guidelines that originally came out from the RACGP, they include a specific pandemic module. And that pandemic module was first introduced, as I said, in 2013, but back in those days, it was really focused on influenza. So obviously in the last 2.5 years, that's changed dramatically, and therefore the content has been reviewed and updated to reflect more of what we've had to deal with around the world or globally with COVID-19. So the ERPT is managed by ourselves and developed in collaboration with the RACGP. We just had a recent review with the college, and I'm really thrilled to say that we've included some new content, which I mentioned at the beginning, and I'll cover what that is when we get through to it. I've also mentioned that the ERPT complies with the 5th edition of the GP standards, and that is the current edition that applies to your accreditation in general practice in Australia. So if you do use the ERPT, it's an automatic tick for your accreditation process for that specific area. You'll notice a bullet point down the bottom, which I think is a very pertinent one. Studies have shown that up to 70% of businesses or organizations who experience a catastrophic event will close within 2 years. Now, whilst that is quite, if you look at that 2008, it's quite old data, that still holds. So it's important to keep that in the back of your mind, because it's not so much about the fact that you're going to stop an emergency or an unplanned event happen, because you're not. It's about how prepared you are and therefore how you can recover from that. Okay, so new additions that I just mentioned in June this year. So we've got new content, and there's 2 brand new modules that have been included, which I'll show you. A mental health and support services module, and a module on patient aggression and violence. Unfortunately, as we all know, what we've gone through in the last 2.5 years, people have been under all sorts of stress, and that sometimes manifests when they come and present at a service provider, including a general practice. And some really unacceptable behaviour occurs, because it's generally the frontline person that is bears the brunt of that. We've also made some changes and edits to existing modules around key contact information, complete or partial loss of premises. Now, the area that we focused in on that particular one was because of what's happened with COVID-19, more and more practices, rather than set up in an alternate site if anything happens to their practice, God forbid it was, for example, we've been made aware of a number of practices that have caught fire over the last sort of 4 or 5 years. And the major route following that was to set up in a different location. But since COVID-19, we've got the ability to do telehealth or work from home. So those options are covered in there. We've updated the pandemic section, and we've updated the COVID safety plan section. So how do you get onto the ERPT? The best way is just go into Google and Google ERPT. That's where you come straight into the sign in page, where you put your own distinct username and password. And when you onboard through that login page, it is hosted on the RACGP website. The ERPT as a tool itself is separate from the RACGP website, but the link or the sign-on link is via that website. So the tool itself is a SaaS tool, so software as a service, and it's hosted on Amazon Web servers in Sydney. So it's all locally stored. Now, we also believe that those big cloud providers, Azure from Microsoft and AWS, Amazon, are probably the most secure of any cloud providers available, or service providers available. We also do vulnerability testing on the platform every year, just to ensure the ongoing security. And whilst we strongly recommend you do not put patient-specific information anywhere near the tool or included in the tool, there is proprietary information to each practice, so it is important. Okay, so what are some of the potential risks that a practice faces? There's a long list of them. And I'm thinking it would have been probably 5 or 6 years ago now that when I was in Victoria, and I went to Marysville and presented at a GP meeting there around the around the ERPT, sorry. And, you know, that was an area, the Black Saturday fires of 2009, where the whole town was decimated. So it was very pertinent and, yeah, very memorable experience for me, that what that region went through, and the importance of having a planning process in place. So you've got bushfire, you've got cyclones if you're in the northern part of Queensland, you know, in your particular region in Victoria, Your bushfires are not uncommon in the rural areas, as we all know. And as you all saw in central Melbourne last year, there was even an earthquake. So all sorts of different things can happen. And then you've got loss of power, disruption of water and gas, telephone disruption, loss of IT, and we've seen that happen. Cyber events, and that was the other module that we included in 2019, was a cyber incident response module. So it covers a whole lot of different risks. That's why I mentioned the all hazards approach. So what are the benefits of using the ERPT? Well, keeping it up to date ensures or helps ensure the safety of staff, smooth recovery of the practice, and reduces the risk of financial loss. Now, I know the RACGP, they did a survey, and this would have been, probably 5 or 6 years ago now, and came up with a set of figures in terms of the average ongoing revenue that comes into a general practice. And this was aimed at an average 4-person general practice. And they estimated that the revenue coming in per day was somewhere between $12,000 and $15,000 per day. So if you think about that as a cost and you want to minimize your downtime so you can provide service to your community, there's also a big financial hit that you want to try and minimize as well. The other thing that's really important is, and I'm told this many, many times by practice managers, it keeps everything important to the practice in one place. It's a really good induction tool for people coming in as well, because everything is there. It's online, so it's available anywhere, anytime, as long as you've got your username and password with you. Compliance for accreditation we've mentioned, and it certainly improves the understanding of emergency response planning. So that's how you access it. There's a URL, erpt.racgp.org.au/standard login. And that's, if you Google that, that's where you'll end up. You put your username and password in there and you're ready to go. Now, if you're a brand new practice, you'll see the comment there that says click on register your practice for the ERPT in red. So when you go into that login page, then you will see the ability to register first time. That register, it requires you to put in just a few details: name of your practice, who's the person that's going to be the admin for it. How's that size, font size?
Yeah, that's not too bad at all.
Okay, great. All right. So what I've done is I've logged into the ERPT, and I can tell that I've logged in because right at the very top, you can see I've got my demonstration plan up here. And I've also got sign out, so I know that I'm signed in. All right, now down the left-hand side, you've got the table of contents. Now you'll note now that there are 18 modules. Now the way to approach completing the ERPT is to break it down into chunks. And our recommendations are, when we're talking to practice managers, is do 2 to 3 modules a week. That way you can manage it, and so it's not too arduous. And just make sure that you set yourself a time frame to get it completed by. And that typically is 1 to 2 months. So just give yourself plenty of time, and then you can work through it in your own pace, because we really know how busy you all are. And you've got the day-to-day running of the practice, and this is something else that you've been asked to complete. The benefit is, once you've completed this, it will take you about 20 minutes each year or each 6 months to review it. Now, to give you an understanding about how long it takes initially, it will take, if you went from woe to go and you wanted to do it in one hit, it would take you about 5 hours to complete it. Hence my comment about breaking it down. Now, at the top of the screen, you'll see there's a video tutorial. It's unlikely that you'll need to view that because it's a very intuitive tool anyway. So the way that you navigate down through the ERPT is you click on each module. So I'm in module 1 now, and I can tell that at the top here. And you'll notice immediately under that there's a help guide. Now that will have a lot of information in behind there that will tell you what to complete. But we have pre-populated quite a bit of content in here to make you think about it anyway, most of which is fit for purpose and which you can add to. Or if you don't like it at all, you can delete it and start again and make it more explicit for your practice. Wherever there's a grey box in the center here, this is where you can go and you can type in. So that's all free text area. Okay, I'm obviously not going to include that, so I'll just delete it. Also down the bottom, you'll see two buttons on the right-hand side, a Save Changes and a Section is Complete button. So once you've added content in and your section is complete, in other words, you've finished that as much as you would like to, then you click that black button. Now, the importance of clicking that black button is that it puts that green tick in the table of contents down that side. And you have to have that there for that section to print or publish in the final version. The recommendations are by experts in emergency response planning that you have at least 2 hard copies of your plan, one on site and one off site. So if somebody needs to grab it in a hurry, they can do so quite easily. So we always suggest to practice managers that the principal GP or the practice manager has a hard copy at home, and then the practice manager may have one either at reception or in their office. Entirely up to you. Okay, so this is where you put all the staff details, including things like contact numbers, where the person lives, how long it takes them to get into work. And what happens is once you add all the people in here, it develops a staff call-in tree by function. It automatically does that. So that section takes quite a bit of time to complete, depending on the size of your staff. And we deal with practices that will have, over 50 employees. So some of them can be quite large. And there's as much flexibility in the tool to add those people as you need. There's an add button down here. You just click on that, adds another box to put another person. And then you save the changes on each occasion. With practice managers, we know they get called away a lot. It'd be really sad if you entered information, somebody calls you away, you forget to save it and you've lost it all. So just make sure that you do that from time to time because there's no auto save. Then what we've got is module 2, and this is, as I mentioned, how we navigate down the page. It's got all the contact numbers for the emergency support agencies for the state that you're in, because in section 1, you put in the state and your PHN. And so it configures this for you. So all your emergency support agencies. Then it asks you with some pre-headed boxes to include your service providers and suppliers, even down to things like accountants and solicitors. Everything in there that's important to the practice. So that takes quite a bit of time as well. But what we typically find is not many changes in a practice happen in a year. So, if there are changes, you can easily make that as you go through the year itself. I'm not going to go through all the modules for sake of time, and I'm watching that closely. But this is a new module, the mental health support services. This came into effect 2 nights ago. So this is about the well-being of your staff and your practice. So it's about mental health support services for your organization. It's about making sure that you think about putting in an EAP, an employee assistance program in place. And there's many providers of that service within your state. Then there's links to RAC GP support program. And those links you can go directly to, and all the contact numbers, and Doctors for Doctors, and the Essential Network, an online e-mental health hub for health workers, and all the other services that may be important to you as an organization. And you can add your own as well by just clicking on that and add more content in here. So the idea is to get you started, but then have the flexibility to really customize it and build your own plan as you work through. So that's that. I'm going to cover module 3. This is a series of risks that was developed by a working group that came out of the RACGP. And they included practice managers, practice nurses, and GPs. And they said, look, here's a common set of risks that can happen anywhere in Australia. However, depending on your location, the priority may differ considerably, as I mentioned earlier. So if I come down here further, If you're in North Queensland, you have tropical cyclone, which would be more important. And what you can do is you can move that, keep moving that to the top by clicking on the arrows. So you get these into a sequence that is important for where you're located. So if you're in rural Victoria, then bush or grass fire may be near the top. So there's quite a few there just to go through. It does require some subjectivity around the likelihood and the consequence. So it's all good. So that's the risk identification. I'll jump into module 4 just to show you the kind of thinking that is included in the tool. Okay, so for a loss of power and thinking about what you need to prepare for so that you can recover more quickly, it automatically pulls in your electricity main supplier and your electrician from the information you've put in module 2, so you don't have to re-enter it. It's asking you as a practice manager to describe where you have got your electrical switchboard in case somebody in your practice needs to turn it off in a hurry. Have you got a UPS installed and uninterruptible power supply? And what's it connected to and how long does it last? Have you got a backup generator? In metro, generally not. In rural, quite often. If you haven't, would you consider hiring one? And then some mitigations or contingency measures for short-term power outages, like making sure you've got hard copy Medicare forms and the like. So that just gives you an example of that particular module. And the same holds for disruption of water, telecommunications, loss of IT. And 7A, this is the cybersecurity response module, and it gives some really clear practical guidance on what to do given a number of probably more malicious cybersecurity events occurring. So suspicious emails, phishing emails, suspicious phone calls, you think you've been scammed, random pop-up messages appearing, even down to things like antivirus displaying a message, a ransomware attack, a data breach, your website's been hacked, etc. So there's some very practical advice in that. So that's a really good training document for members of your staff as well. This is the additional module that was added in the other night as well around telehealth. Again, pre-populated, so you can just look at that, react to it. If you don't like it, you can delete it and start again, or you can add to it depending on what you think of the content. But rest assured, I think the content's pretty good. It comes directly from the RACGP. And then some other considerations that you need to think about as well. I'll jump down, have a quick look at unique identifiers. I'm just doing this from time perspective. This is where you enter details about your practice. So bank account, GST, ABN, could be other contract numbers or other. And then also for your staff, you can put in, for example, for your doctors, you can put in their registration number, their provider number, and their prescriber number. And you can do that also for allied health and nursing staff as well. So it just puts everything in one place. Then there's some guidance around communication during an emergency. Okay, who do you need to communicate to if your premise was compromised, and how would you do that? You'd need to notify your PHN, any other parties like local pharmacies, etc. You'd need to notify. Some key contacts that you would be, first and foremost, you would need to let know that something had happened, and who's in charge of the media policy and who's the backup, etc. So some really good practical advice in there. There's an insurance section, loss of or non-availability of key staff. Now that is, would you use locum agencies to acquire staff at short notice? Yes or no, and then it takes you through a whole lot of different questions to put around that. The BCP, or the business continuity plan, that is where we know the accreditors look at quite often, and it's about what kind of services you would need to restore first and foremost if anything happened. For example, it could be payroll and Medicare billing, or it could be something like provision of GP services to an aged care facility, and who's responsible and what are the dependencies around that. So quite an important module. Module 16, This is a very in-depth module that comes from the Managing Pandemics and General Practice Guideline that the RACGP put out and amend every year. So it's about staff roles and responsibilities. Once you've got all your staff members in one, they appear here in the drop-down. Except it's not behaving itself. It's not going to let, no, there they are. And then you can allocate those roles and responsibilities for the pandemic leader, the pandemic coordinator, the communication coordinator, what you need to think about from staff rostering, which staff members are willing to work in different scenarios, what immunizations have been actually undertaken with members of your staff. And this list here, which currently grayed out, that's just recently been updated. Those are the RACGP's recommendations for all GP practices to consider. And then when you come down past that, which is depending on the number of staff, there's a lot in there. Then there's a training register for hand hygiene prevention, infection prevention, control cleaning, and application removal of PPE. And then equipment and supplies, consumables required, and what's your stock and where do you keep them? Infection prevention and control register, cleaning policy, and a waste management policy and managing the facility during a pandemic. The COVID safety plan, I won't go into that, but it covers all the criteria that the college developed specifically for general practice around what's important in a COVID safety plan for your practice. And finally, module 18, which again was added in 2 nights ago. So this is about patient aggression and violence and what to think about from a practice. So what is your practice policy around that? What have you agreed upon that is acceptable behavior for people coming into your practice and what's not? Some definitions around patient aggression and violence, early intervention strategies to de-escalate that. Again, some good content in there for you to think about and add to if you find necessary. Responding to an act or a threat, and a follow-up response. So some really good advice in there. Now, once you've done that and you're happy with what everything's done, then what you do is you click on the button down the bottom, follow the prompts, download and print. This takes a moment, but it's generally pretty quick. It downloads it to a PDF A4 version, which will automatically configure to your printer setup. And I'll show you what that looks like and what you get at the end. So this is a document. You can see I've done a few of these. So version 231, if you're a brand new practice, you'll be version 1. The date, all the regalia around the RACGP and the ERPT, where copies of the plan, hard copies are kept, any documents that you've uploaded into the plan, and you do that on the front page. So it is a cloud tool. So a lot of practices would upload things like policy documents or site evacuation plans and the like. Then what are the first 5 things somebody should do within your practice if an event happens? Table of contents, and then in print in 1 or 2 pages, all your staff details with their contacts, the call-in tree, all your suppliers with all their contact details, then the mental health support services, the risk identification, the hazard, the likelihood, the consequence, and what you need to do as a practice to prepare, recover, and respond for each of those. And then into the specific modules around loss of power, etc. So you end up with about a 60-page document. So very comprehensive. That's where you keep a hard copy. So that is it. And I'd like to actually stop sharing my screen now and then open it up for any questions or comments.
John, before we go to questions, I'd like to introduce Majella. Majella Beagley is a very experienced practice manager in our catchment who has had cause to use the ERPT not so long ago. Welcome, Majella. Would you like to give us a summary of your experience using the tool?
Sure. Thanks, Leonie. Thank you for having me. As a lot of practice managers know in my network, I've used this and used it. It literally saved the clinic and our life. I actually did the ERPT in 2018 as pre-accreditation, because it covered, for the first time, we were being asked for business continuity plans, pandemic plans and the like. And so I spent about 3 months, lots of interruptions, John, preparing mine, but, you know, got it through and, you know, had it for accreditation, and it ticked lots of boxes, and it was actually quite good. Never, ever did I think I would have to use it. In the early hours of August 2019, someone broke into our clinic and set it on fire. So I attended here at 12:30 in the morning on this Monday morning, freezing cold, as did the principal partner. We watched as the fire was put out. The perpetrator was pulled out of the fire in a critical condition and taken off in ambulances, and you know, the whole roads were shut off because of this fire, and all the emergency vehicles. So at about 2:30, the principal partner looks at me and says, well, what do we do? And I said, well, we've got patients arriving at 8 o'clock in the morning, and this is a crime scene. So I said to him, you know that red folder I gave you some time ago to take home and keep in your office? And I know you'll all have this feeling of dread. Did he do it? He said, yeah, I think I've got it somewhere. I said, well, actually, I need that hard copy tomorrow. That's going to give you all the phone numbers of the doctors to ring before they come to work to say, don't come. I took on the role of ringing all the administration staff and nursing staff to tell them not to come to work until I called them. And the last message I left him with was, I need that hard copy tomorrow, because our building was a crime scene until about 3 o'clock in the afternoon. We adapted the wheelie bin as our stand-up desk in the car park. We had a couple of the partners, and we had no idea of who was coming for what appointment, when, you know, and this is, we're still talking a few years back, but we've adapted and changed, and we can work from home and we can access things from home. But of course, our server was down, so we couldn't access anything. So we got to work that Monday morning, freezing cold. And as patients arrived, we actually said, you know, what were you coming for? You know, my office manager and a couple of the partners were dealing with that. I took the hard copy that had in it our insurance company details, our policy numbers, my electrician, who was an absolute legend, our IT companies, our phone companies, our medical software company, because of course we couldn't turn off the online appointments. So we knew we didn't have a fully booked day at the beginning of the day, but it would be by the end of the day. And we had no way of communicating with these people that our practice was a crime scene. So I went and begged an office in an adjoining building, and I sat down with my mobile and I made all these phone calls. First of all, lodged the insurance claim, contacted the medical software, contacted my electrician to say, look, this has happened. It's in the room where the switchboard is. I think the switchboard's dead. What can you do? His instructions to me were, as soon as you can get in the building, send me a photo and I'll come straight away. And he actually arrived about 4 o'clock in the afternoon, assessed what he needed, went and got all the materials, came back and rebuilt the switchboard, working till 4 o'clock in the morning, so we could actually open up the next day. So we also contacted the local pharmacies to say, we can't provide our patients with prescriptions. Will you fill them? And we will send the prescriptions when we can get back up and going. Knowing my insurance policy inside out, when the insurance assessor came and he looked around and he said, oh, you're going to be closed for 6 weeks. And I said, oh, really? You do know I've got business interruption insurance in my policy, and that'll be fine. We can all have a holiday and you're going to foot the bill. And he said, oh. And then he looked at my electrician there and said, is your electrician happy to work through the night? Because we're happy to pay him, because if he's here, he knows what he's doing. I won't be able to get an electrician to assess it till tomorrow. So you're going to be days without a switchboard. the dollar signs were ticking over in his head. So he was happy to pay my electrician at triple rates to work through the night. And we opened up the next day, minus 2 rooms, the one where the fire was, the one where the break-in was. We just had to section off part of the clinic. But if I hadn't have had that hard copy, because I had no internet apart from my mobile phone, and the battery was running low on that very quickly, because I was on it all the time. If I hadn't have had that hard copy, I wouldn't have had access to all that vital information that I needed to enact all the things that we had to get us open up the next day. So we, in fact, had those 2 rooms rebuilt within 3 weeks. We were able to stop the online appointments for the rest of the week through our medical software. So the people that we couldn't see on the Monday that we had to get back on the Tuesday, Wednesday, Thursday, Friday, we actually had available appointments for. So it's not until you actually have to use something like this that you think, oh goodness, I'm so glad I spent the time. But actually the second time that we actually used the ERPT was the call of the pandemic. I was actually in New York, and I had prepared this pandemic. You know, as John said, it was very much around flu at that time. I had prepared a very basic pandemic plan, thinking, once again, never use it. When will there ever be a pandemic across the world? And, you know, so my staff, while I was in quarantine for 2 weeks, having returned from New York very quickly, they were actually able to access that and follow guidelines of who was to do what, how we were going to do things. And that then I used the ERPT as my COVID plan, and every update. And if we all remember back to those first few weeks and months, we were updating every hour as different countries were affected and different guidelines were coming out. And, you know, every morning I would update the COVID plan for the day and say to the team, this is the plan for today, wait till tomorrow. And, you know, so I actually found it a really good portal, one, because I could access it in the cloud, and 2, that hard copy kept in the principal partner's home meant that we could hit the ground running at 7:30 or so the next morning and make those phone calls that we really needed to make to get things into action and actually get our business back and open. And I mean, that included, you know, being able to order vaccines, because we lost everything because our power was off for more than 24 hours. And so I also use it for cold chain management. All the information is in there, the cold chain reporting, you know, how much stock we need if we lose everything. And, you know, also knowing your insurance policies. My vaccine's always covered in the insurance policy for loss for private vaccines through, you know, an incident that's, you know, nothing to do with us. So, you know, the person who broke into our building survived, although it was very unlikely that he was going to. And in fact, I need to go to court in August this year. So 3 years it's taken to get to this point. But in a nutshell, we were closed one day. We had 2 rooms out of action for 3 weeks, and amazing staff that, you know, could work around all these things and adapt and become champions of change as we had to through this process. But I think the ERPT actually helped us minimise the damage to the clinic in as far as our patient care, our business income, and, you know, having everything at my fingertips meant that we could get everything into action quite quickly. So happy to take any questions if you've got any.
At the moment, everyone's a bit quiet. They're digesting that wonderful information. Majella, it's terrific to have access to your knowledge and direct experience too.
That's all right. Actually, John, I've got a question. I'm mentoring a couple of practice managers, and I was at one on Monday, and she's taken over, and I was talking about the ERPT. It was set up by a previous practice manager, and no one knows the logins. How can she access it? I've assured her it's in the cloud somewhere. How can she access it without having to start from scratch all over again?
Yeah, so typically what happens is, for a variety of reasons, we may we may archive the plan. So for example, if a practice says to us, they have decided they're not going to use it for a couple of years, then what we'll do is we'll just put it in an archive, which means we can restore it easily. But if somebody has lost their details, they can click on forgotten password if they were the original person that sets up. But if they're not, they come to us. And once you've gone to the website and looked at the, say that login website, right at the top, it's got support, and there's a 1-800 number there, and there's an email address. They send an email to us, we pick it up, and we will reset their username and password and send it to them.
Great.
That's terrific. We haven't got any questions coming through at the moment. Everybody's quite busy, so we might wrap things up. Please remember, if you do have a question later on, let the practice support team know at MFIN, and we'll get an answer from John for you, or perhaps even reach out to Majella. John and Majella, thank you so much for that wonderful information. Bit of a shame we had a few little glitches at the beginning, but John, it was wonderful to actually be able to see right through the ERPT, to have a look at that demonstration. That was great. Thank you so much.
That's a pleasure. I've got one comment, Leonie, just that I think is really important for everybody as well. Firstly, acknowledging Margella, because it's fantastic to hear firsthand experience. So thank you for that. Very, very gracious of you to share that. So thank you. And the other thing too, Victoria is the only state in Australia where the Department of Health is funding practices to access the ERPT, which not only is admirable, I think it's quite an innovative way for the Department of Health to look at how can we support general practice to make a tool like this available to really shore up primary care across the state. So there are a number of licenses still available, and that funding goes on for at least another 2 more years.
Thanks, John. Just to clarify, that's the state government Department of Health that's funding the ERPT for our practices.
Correct.
That's right. So thank you again, John and Majella. Just reminding everybody, the PHN is here to assist you. So please reach out if you need support. And just a quick reminder before we go that the evaluation survey is waiting for you as well. We really value your feedback, so we can continue to provide education to enhance the wonderful work all the practices are doing. Enjoy the rest of your day, everybody, and we look forward to seeing you at our next event. Bye for now.
Bye.